Hernandez, and I would like to start off by taking a deep breath and think of somebody you truly care of and are willing to do anything in this world. Now that you have someone in mind, close your eyes for just a second and imagine she or he fell down on the ground and they weren't able to breathe. Would you be able to help them? Or would you be able to do CPR? If not, class, don't worry. In these few minutes, I am going to teach you the proper ways of how to do CPR. Let's first off start off what CPR stands for. CPR stands for Cardiac Pulmonary Resuscitation, which is the first tool given when someone suffers from a cardiac arrest. Cardiac arrest is when your heart stops pumping and CPR is needed. It is important for you guys to learn CPR because you never know when someone could suffer from a cardiac arrest and you can save someone's life. I've been a nurse attendant for over a year already and I have some hands-on experience. I have assisted on some code blues at the hospital I work at. Code blue stands for someone that is suffering from a cardiac arrest and someone from the floor or staffing immediately runs to the patient's room and starts CPR. CPR has 3 important rules, which are the 3 C's: check, call, and care. If you're able to do these 3 important steps, you're able to definitely save someone's life in just seconds. Let's first start off with the environment. It is always important for you to check the environment. You don't want to put yourself or the victim in any more danger. Always check for the victim to be flat on the ground before touching him. After checking the environment is safe, you start by checking the victim's pulse. You can check it on the inside of the wrist or on the neck. These 2 places are the most important places where you can rapidly find a pulse in just seconds. After checking for a pulse, you are encouraged to shake the patient, in this case the victim, and tell them, sir, are you awake? After checking the environment is safe, the next step is very important, is getting for help. Now pay close attention. If you're alone, it's going to be a little bit more work, but it's not difficult. You immediately grab your phone, put it on speaker, call the operator, 911, and most importantly, give as much details to the operator: name, location, how did it happen, if you know, how are you related, any questions the operator may ask, you respond clearly, and never forget to always let the operator hang up, never hang up on the operator, just to make sure that everything is clear and given all details. If you're not alone, then this step is easier because you just assign someone and let them know to call 911. After calling 911 and checking on the victim, you start the care, which is the last step of the 3 C's. Care. You always start by making sure the victim is flat on the ground. You place both hands. You place the heel of your hand on the center and the opposite hand on top. I'm going to insert a picture right above me of how your hands are supposed to look. You center it on the victim's chest and you start compressions right away, going 2 inches down, and after going 30 compressions, you give 2 rescue breaths. I'm going to insert a video down here of the song Staying Alive. It's normally the rhythm of how do you do compressions if you know the song. If not, you just count 30 compressions, fast, 30 compressions, and 2 rescue breaths until someone that could help you or help is sent could come and help you out. In these few minutes, I have taught you the most important ways of how to do CPR on the victim. Overall, have a better understanding of the 3 C's, and today we have discussed how to check, call, and most importantly, give the care for the victim that have suffered from a cardiac arrest. It is important for you guys to learn CPR because you never know when someone, loved ones, or your loved one can suffer from a cardiac arrest, and you can save them in just seconds from learning these 3 important C's. So always remember, check, call, and care. Thank you so much for listening about how to do CPR.